with Linda Woodhouse, and then we found out she's done like 20 research articles, and we're just like shaking while she was asking us questions.
We
She's like, what does p-value mean? I'm like, I gave her the definition. She's like, what does it mean? I'm like, I don't know how else to do it. Like, what else do I do? Let me just shut the blinds. Andrew's on Zoom, so we have to just use the lighting's more sensitive. What's for lunch, Andrew?
I don't know yet.
You have protein? Oh, so good. I had a patient last week drop off protein, which is like a traditional East Indian lunch, like just so good. And she gave me so many. She said, "Oh, it's just like enough for lunch." Literally, it's food for 3 days. Like, I kid you not.
You were
And I can eat a lot. And she's like, "Oh, it's just a few," and there's 8 in there. 8
Wow.
with potatoes, the alu ones, yeah. So I'm gonna do something rude on Joe to mute you.
Thank you.
I'm sorry.
Thank
Oh,
you.
You're welcome. Now let's talk some about Andrew. No. So yeah, she was supportive when the clinic opened up. Checked it out, and a few other students. So has shown ongoing support. So yeah, we can get started, I guess. That's good. Andrew hasn't been in a while. I was about to not even use Zoom today.
You said.
So this
I
is
don't know
good.
if Zoom's a thing anymore.
Yeah, Zoom's old school now. So I'm just gonna share this. There, yeah, that one. I'm gonna share the screen, so we're gonna get started, guys. If you guys have any questions, just type them out and just throw them up right away. And then we can talk about them at the end. So, without further ado, oh, there we go. Hopefully the computer doesn't like crash again.
Fingers crossed,
I
yeah.
have no clue what happened there. So we got scapular control and stability. We've like covered the shoulder a few times, but kind of all over the place. Like we talked about shoulder with Olympic lifting, so that was a little bit of shoulder there. And then we talked about shoulder with Judy Chapea, which is more rotator cuffs issue. So today we're going into scapular control and stability specifically, which is, I think, something there's more research on, and definitely going to should be more applied to treatments and things like that. So I know for me, practicing for a bit of time, I used to do things a bit differently. I did do some scapular control and stability, but honestly didn't know why I was doing it.
Yeah.
Like I was told to do it, which is fine, but I didn't really know like the implications of it and why we do it. And then it's not until I understood the why that I think I get pretty good results with individuals. Shoulder initially when I treated, so you might, hopefully you don't learn this way. I was like frustrated. Like every time I got a shoulder, I had anxiety. Because I'm like, there's nothing I can do that makes it better. And then I learned to keep it simple. So that's my story. And this was Brooke's idea, so credit to her. She did everything.
Right.
I'm just gonna read off her notes.
Oh.
So shoulder injuries. I'm sure a lot of you have had shoulder injuries. So it's one injury that can be very challenging. Shoulder pain is the third leading musculoskeletal complaint in primary care, which is significant. So quite a few injuries that we see in clinic and then obviously in the hospital. So the big thing with this is like you can actually go see a physio first instead of going to the hospital, for example, and you get the treatment you need faster and then save healthcare as well, so someone else can get some care that's needed. I mean, yes, if you can't move your arm and it's excruciating, then go to the hospital, but yeah, so prevalence is as high as 26%. 2/3 of adults experience shoulder pain at some point, which is significant. Like I've had it many times, so I'm in this whole age group as well. So prevalence is highest in middle age, 40 to 65. I am not there yet, so that's good. And only about 50% of patients recover within 6 months of onset. So that's also an important point, being into a chronic issue. So not chronic pain directly, but if you see half of people have pain over 6 months, then you develop some chronic pathways, and then it gets into a little bit more complex management. Then someone like Brandon, for instance, would be the physio to see. Yeah, so those are some important facts and quite, I guess to me, not shocking because I knew there was quite a few shoulder injuries, but about half not recovering in a certain amount of time is pretty crazy to me. Yeah, so surgery, everyone thinks surgery for shoulder, that can complicate things and it's pretty risky. We see a big shift of conservative management currently, conservative being physio, chiro, that kind of stuff. 80% of referrals to surgeons see PT first. I got this stat through the Bone and Joint Clinic down on the other end of the north end of Edmonton. So they get like hundreds, if not like 1,000 referrals a month. So everyone, it's a triage system in which you get assessed by a surgeon and a physio, and then you are referred to a physio or to get surgery. So 20% of people are there right away get surgery because their injury is bad enough, but 80% get referred to physio, which is a big number. So now they're realizing conservative is the way to go because complications of surgery after a certain age, I see some more challenges with rehab, like after 45, 50, then it can be pretty rough versus someone who's young, pretty straightforward. So complication rate of surgery is approximately 4.8 to 10.6%, which is a pretty big number. That's not due to the surgeon, it's just the way things are with the shoulder. Yeah, and I can flip this to some anatomy and then I can let Brooke talk about this. I'm just gonna
move things around.
there we go. There's the
Okay.
shoulder. I'm gonna zoom in a little bit. Okay, you're good.
So some anatomy with the shoulder. So the shoulder blade is actually called the scapula. So that's this triangular bone here. And it kind of works with some other joint to create some joints of the shoulder. So the main one here, the humerus, which is the bone in the top of your arm, connects with the scapula or the shoulder blade to create that glenohumeral joint, which is what allows us to move our arm. And then there are some bony prominence on the scapula. So here's the spine of the scapula, and that goes around to create the acromion, which attaches with the clavicle to create the AC joint, which you might be familiar if you've had like a hockey injury or anything there in the past. And then there's also another joint. It's not a true joint, it's more of an articulation, but where the scapula articulates with the posterior part of the thoracic, so the rib cage there. So the shoulder blade moves and it allows for kind of movement at the arm, and it's actually really important when we see shoulder pain. Sometimes it can be from kind of some scapular issues that we're going to talk about a little bit more.
So different injuries. I just put this up. We're not going to go through each individual injury, but just looking at the scapula and control as a whole. I think it needs to be done in every injury. So you have shoulder impingement, which is one of the most common injuries. You have rotator cuff pathology, so small strains. OA osteoarthritis you get in the glenohumeral joint, as well as the AC joint. We see it quite a bit. AC joint pathology, so there's lots of ligaments there that can be of an issue. Dislocations, I've seen quite. Actually, it's weird. I get the dislocations in spurts. Like I had 3 people after surgery from multiple dislocations. So getting what's called a Bankart repair. Subluxations and tendinopathy. So those are like the main injuries. So you can see there's quite a few different ones. So quite a few different ways to injure your shoulder. Things we always see. I like this because I like to split things up into, like, I try to keep it simple. So most people usually have a mobility issue or a stability issue. So, and acutely you have both. Like if you're just got injured, you see both. But after quite some time, you see patients and they have a mobility issue, so loss of range of motion, stiffness, soreness, cannot perform overhead movements, or they have a motor control or stability issue, so they have scapular dysfunction, scapular setting issues, and lack of strength and endurance, both of which present certain problems. And usually when you go from mobility, you move on to stability, so you're going to do both anyways. But I know we can characterize people into that, and once that's done, it's a bit easier to treat, rather than looking at like every little thing and then treating every little thing. If you keep it simple, then you can kind of cover quite a few things. Yeah.
So then lots of those kind of injuries that Sunny referred to are going to show kind of pain at the shoulder, but lots of times it can be coming kind of from the scapula movement itself that we're going to talk a little bit about. So some people might have heard of kind of scapulohumeral rhythm. So what that just means is kind of the interaction of the scapula or the shoulder blade and your humerus. And those are important to kind of move together to create optimal shoulder function as you raise your arm. If those two don't work well, then you start to see some of those injuries like impingement or rotator cuff things that we referred to earlier. So it kind of just refers to a ratio of glenohumeral, that's the joint we talked about earlier at the shoulder movement, and then that scapulothoracic movement. So when you raise your arm, kind of the humerus, your arm bone allows for kind of roughly about like 120 degrees of flexion. And in order to get that kind of remaining 60 degrees, we need that scapula to rotate. So it's important that they're working together to have full arm range of motion.
Yeah, there we go.
So then if we talk about kind of stabilization of the scapula and kind of the kinematics of the scapula itself, it's really important because it's been shown that abnormal scapular movement or positions actually leads to lots of those glenohumeral or shoulder pathologies that we talked about earlier, and that's been pretty well established with the research. So those patients that kind of come in with some impingement or rotator cuff issues, they often also show like scapular issues as well, so they're not having proper movement of that scapula, which can kind of be coined as scapular dyskinesis. So that's that lack of upward rotation of the scapula, which we'll go through some of the movements after, as well as like a posterior tilt, which is needed to decrease the chances of that impingement. And then they have like more of an increased internal or medial rotation of the scapula. So by affecting some of the recruitment patterns and the muscles and the performance of those muscles that help with scapular stabilization, you can also help with some of the shoulder pain people might be having. And then also taking a look at some of the soft tissue flexibility. Sometimes if it's more of a stiffness as opposed to a control impairment, then making sure that you're addressing some of those flexibility limitations. So these are kind of the movements of the scapula. It actually has quite a vast amount of movements that we can kind of show later. But the first one, elevation, that's going to be kind of like you're shrugging your shoulders up towards your ears.
Oops, what the heck?
There you go.
This computer.
And then the next one's going to be depression, so kind of lowering the shoulder blades down. And then adduction or retraction, so that's thinking about kind of squeezing your shoulder blades together. Abduction would be kind of spreading them apart, or protraction. And then this is that kind of upward rotation we're talking about. So as you raise your arm up, we want the scapula to kind of upwardly or laterally rotate. And then also having that downward or medial rotation. So because the scapula essentially doesn't have too many bony attachments to the thoracic, it relies a lot on the musculature around it. And these are what we're really targeting when we're talking about kind of scapular stabilization or control. So these are kind of, like we said, the dream team there of muscles that are going to help making sure your scapula is moving optimally to decrease some of those pathologies that you can see at the shoulder there. So the first one here, if we look at, is the lev scap. So that one kind of comes up in the cervical segments here, and it comes and it inserts kind of on the top of that shoulder blade or the scapula. So when this one contracts, what it does is it helps to elevate the shoulder blade and also downwardly rotate the scapula. Then we have our rhomboids here, and those are going to help to retract, so kind of like that pinching the shoulder blades together movement, as well as provide some downward rotation of the scapula. And then we have our serratus anterior, which is the muscle that's kind of along the side of your rib cage here, kind of under your armpit. And that one helps to protract or essentially separate the scapula from each other. And it also assists a bit in that upward rotation, which is needed when we're raising our arm up. And then on the front, it's not pictured here, but one of our pec muscles, pec minor, attaches to what we call the coracoid process, which is on the front of the shoulder blade here. And what that does is it provides like an anterior tilt to the scapula, which we're going to talk a little bit more later on, but that can actually be a little bit problematic because as you might remember, when we said this arm raises up, that scapula needs to actually posteriorly tilt. So if it doesn't have that posterior tilt due to that pec minor tightness, then that can lead to some altered shoulder mechanics. And then the last one is the trapezius, which we're going to talk about quite a bit. So the trapezius, for those of you that aren't familiar, can be broken into kind of three parts. So we have the upper trapezius, which is our upper traps, which lots of people are a bit more familiar with. And then we have the middle trapezius, which is kind of the middle fibers here. And then we have our lower trapezius. And all of these kind of have a different line of pull with the muscle fibers. So the upper traps are mainly responsible for elevating the shoulder blade. So if you think about doing shrugs in the gym or even just shrugging your shoulders, you'll see that that kind of brings the scapula or the shoulder blade up. And then the middle traps here are going to be mainly for retraction. So they're going to kind of retract or squeeze those shoulder blades together, similar to how those rhomboids were doing. And then the lower traps are one that's going to be really important. We're going to talk a little bit more in depth. Is it's going to help to depress the shoulder blade. As you can see, the line of the fibers here are going to pull and depress the shoulder blade. But a little bit even more importantly is they're going to help upwardly rotate the shoulder blade. So you're going to see that this shoulder blade is then going to have that upward rotation. If we have that upward rotation of the shoulder blade, then we also have upward rotation of this glenoid fossa. That's where the humerus or the arm bone meets the scapula to form the shoulder blade. So if this has that upward rotation, then it prevents any kind of impingement or pinching of the tendons and other structures that can occur at the shoulder that leads to further issues. So some common culprits that we see that are going to lead to some shoulder pain that could be coming more from the scapula as opposed to the shoulder itself is going to be largely dependent on kind of the causal piece. So we mentioned earlier that Sunny said he kind of splits it into more of a mobility issue or a control issue. So we're going to have to take a look at kind of if it's more of a weakness, if there's an imbalance, stiffness, or if it was more of like a trauma, and that's going to affect the treatment. But oftentimes in some of the research talks about this kind of upper trap, which we just described, and the lower trap imbalance. So lots of times if we're a little bit more dominant in our upper traps, then we start to see those lower traps aren't being used as readily. And because they're so important in kind of that upward rotation of the scapula, if we have this imbalance here, then we don't have that kind of optimal positioning of the shoulder joint, and we can start to see issues. Another common area that might be affected is some serratus anterior weakness. So then we have kind of that decreased ability to keep the scapula against the thoracic wall when we're raising the arm, which can lead to some other issues. And then like we talked about earlier, that pec minor tightness, that's going to pull that scapula anteriorly and decreases that posterior tilt that we talked about that's needed when you're raising the arm. So now we'll go through some kind of exercises and some general things that you can do to help kind of with that scapular mobility, and we can kind of show on each other what we're looking for when raising the arm and stuff like that.
All right, so I can just do this view so we can, actually, yeah, there we go. That's good, you can see us. There we go.
Okay. So maybe if you want to stand up and you go through some arm movements, we can kind of just show what we're looking for.
Let me just adjust this so everyone can see. That should be good, I think. The wonders of technology. You want me to stand up or should I stay sitting?
You can sit, then they can probably see a little
Yeah,
bit
there we go.
better.
I think we can all see.
Okay, so if Sunny was just to kind of raise his arms into flexion there. So as you can see, lots of people think about the arm moving, but we don't often think about kind of the shoulder blade moving. So if Sunny slowly lowers back down. So during the first kind of initial like 0 to 30 degrees of kind of that flexion or abduction movement, it is coming mainly from kind of his arm. So Sunny slowly comes up to there. But as we get closer to kind of that 90 degrees, you start to see that the shoulder is going to go into kind of what we talked about is that upward rotation. So if my hand was kind of Sunny's shoulder blade, you're going to see it kind of rotate up to put that like glenoid fossa in a better position so that he can have full arm flexion. So when his arm's all the way up here, we have kind of that medial rotation of the shoulder blade, lateral rotation of the shoulder blade, and also that posterior tilt. So some things that we're going to want to address then is making sure that we have proper muscle strength, that he can have that upward rotation of the shoulder blade, and then that he's not having any tightness kind of in the front that's limiting that posterior tilt. Go ahead and come back down. So like we talked about earlier, lots of times when people are doing kind of shoulder movements, they might initiate a lot with their upper traps, or they don't have kind of proper awareness of the mechanics to kind of activate their lower traps to help with that upward rotation. So those are the first thing we're going to work on is a little bit of strengthening of kind of those lower traps to help target those muscles so that when you're doing some of your arm movements, you're making sure that that muscle's firing to put that shoulder blade in a more optimal position to decrease some of those rotator cuff or impingement type things. So we'll demonstrate some of those. So there's a few different ones that we can do for lower traps.
Oh, Judy's here.
Oh, hello, Judy. So we'll start off with some of them that you don't need much equipment for, and then we can move into kind of some more if you find that those ones are a little bit simpler, you're ready for some more kind of strength-based ones, we can kind of progress from there. So maybe we'll I'll grab a ball, or we can just
Yeah.
do it on a bench.
Yeah, I can set up. I can take care of the tech stuff. if you
Okay.
want.
I'll
You
grab-
position yourself, and I can set this all up.
do the ball.
And Judy says hi.
Judy, you joined for a great time. Talk
Yeah.
about the scapula and the shoulder blade.
I thought I'd ask Judy too, but then, I don't want to overburden the great Judy, Commander in Chief.
Famous Judy would have got us a lot of views,
Famous-
but that's
yeah.
okay. Okay, so the first one that we talk about with some of these exercises, we're wanting to think about kind of, like we said, the lower traps are kind of a depressor and also an upward rotator of the scapula. So one exercise you can do is you can either be on a ball or you can even kind of be on the edge of your couch and lying down like this. From here, what you're gonna do is you're gonna think about raising your arms up. When you do this though, you don't want to think about kind of shrugging your shoulders. Those are the upper traps that like to take over, and we commonly see are a bit overactive in people. So for this one, what you want to think about doing is you want to think about kind of a thumbs up movement. Having your thumbs up puts that shoulder in a little bit of external rotation, which is just a little bit more beneficial for that lower trap activation, and also takes out any kind of impingement that you might be getting if your shoulders are in that internal rotation position. So from here, what you're going to think about doing is you're going to think about kind of creating a Y. As you do that, you want to think about taking your shoulder blades and kind of tucking them into your back pocket, essentially. So what that's going to look like is you're going to kind of come up, thinking about squeezing those shoulder blades kind of down and back together, and then slowly coming back down. If it's too hard to think about doing both at the same time, you can just do one arm. So coming up, making sure you're not initiating with these upper traps. Holding for 2 seconds, and then slowly coming back down. So you should feel like you're moving the shoulder blade down and back, kind of squeezing it in towards midline there. So again, coming up, holding for 2 to 3 seconds, and slowly coming back down. So that's kind of the first one that is fairly simple to do. If you find that you're having trouble kind of keeping these muscles turned off, you can start with your arms in a little bit more of a lower position and just kind of get used to kind of squeezing that shoulder blade back. If you haven't done a lot of scapular work, you might be a little bit unfamiliar with how to even move your scapula, so that could be a bit confusing. So just start with your arms kind of at the side here, and then just think about kind of squeezing those shoulder blades down and back. You might find it a little bit easier not to engage those upper traps. Okay. And then another one that we can do kind of for lower traps, because the lower traps kind of work in conjunction with the rotator cuff, which we talked quite a bit about earlier, is that we can do kind of like an external rotation press. So we'll demonstrate that one over here.
You can do it on that pole if you
Yeah.
want, or I can move this closer. There we go. Judy, just popping in to say hi and good job. Gotta go to another meeting. All right, bye, Judy. Too cool for us, I guess.
So for this one, you can just take any kind of elastic band that you have and wrap it around like a kitchen table leg, or if you have like a banister in the hallway. And for this one, what you're going to be doing is you're going to have
I'm just gonna flip this over
good
here.
position there.
Yeah. I may as well get this like perfect.
So from here, you're going to have that arm kind of at 90 degrees. And what you're going to think about doing is you're going to think about kind of pulling back. Now when you do that, you want to think about initiating the movement with your shoulder blade as well, as opposed to just your arm. So think about kind of bringing that shoulder blade back in towards kind of the middle of your back there. So squeezing back here. And for now, you might find that that's kind of enough and that you're kind of feeling that that shoulder blade's really working. And then just coming back forward. So thinking about bringing this shoulder blade kind of down and back. So from here, squeezing down and back and forward. If you get the hang of that, or that feels pretty easy, a way to even get a little bit more engagement of those lower traps is going to be coming back like this. And then from here, you're going to be rotating your arm up and back down. Now when you go to rotate your arm back like this, you should feel that those lower kind of fibers of the trapezius are firing a little bit more. And you should feel that you can feel kind of that muscle contracting there, and then slowly coming back. Now another key with this is once you get into this position, make sure that when you're returning to neutral, you're not kind of just letting your arm flop back. You want to make sure that you're still maintaining a good contraction of those muscles. So once you're in this position, slow and controlled, keeping all those shoulder blade muscles engaged, coming back here, and then straightening out. It's good to make sure that you're training those muscles kind of concentrically, but also that eccentric contraction there. So those are a couple of variations for kind of lower trap strengthening. And then once you kind of have those specifically targeted, we can start to do some exercises that kind of incorporate all the musculature around the shoulder, which is good with some kettlebell carries. I know Sunny likes those. So there's kind of lots of different things we can do with kettlebell carries essentially. If we want to show some of those.
Sure. Your call. You can show it. I can show it. Doesn't
Matter, you are.
Well, that's good. You like being put on the spot, so I'm okay with that.
Okay,
I can.
I'll show them.
I can be the camera person.
So the first one is just kind of like more of a simple kettlebell carry, which is a good way to start if you're like feeling a little bit more comfortable with activating some of those shoulder blade muscles. It's a good way to kind of get everything firing together. So you could take a kettlebell or a milk jug or anything you have at home in your hand. You're just going to have it by your side. From here, you'll think about kind of getting into good posture, so those shoulders are going to kind of come back just ever so slightly. And from here, what I want you to think about now is kind of activating all the muscles around your shoulders. So thinking about bringing that shoulder blade kind of down and back, squeezing in through there. And then you're also going to think about kind of squeezing all through your arm too to activate all of those muscles. That we're going to get everything kind of firing together. We want all the muscles to be firing together, so when you start to do more overhead stuff or a little bit more functional movements, that you can activate all those muscles. So kind of squeezing all those muscles together, ensuring everything's activated, and then maintaining that kind of contraction as you're walking. So you can do like a length of your kitchen or a hallway, and just making sure you're kind of keeping all of those muscles activated as you're walking. I won't actually walk here, but a thing to think about when you're doing this one though, is you don't want to kind of let that shoulder creep up and let those upper traps kind of take the weight. So making sure that that shoulder's kind of staying down and back, and we're minimizing the use of these upper traps. And then also make sure you're not kind of leaning to the side here. You want to make sure that you're just staying neutral and you're using all those muscles to engage. So same thing, coming back, squeezing all of the muscles of the arm and the shoulder blade, and then going for a bit of a walk with that, getting used to kind of maintaining that contraction. And then if those are kind of easy, the last one will probably show exercise-wise, can be kind of more of like an overhead kettlebell carry. Because ideally, if you're starting to have pain in your shoulder, it's likely when you're overhead. So we want you to get a little bit more comfortable kind of in those overhead movements. And we don't want to always say like don't use your upper traps, because those are a muscle that we do want to use, but it's just training them in conjunction kind of with the lower traps. So what you'll do for this one is you would kind of bring your arm up into that overhead position. This way that shoulder's kind of in that upward rotated position. So the lower traps are in a good position to fire. So from here, kind of thinking about the same thing, bringing that shoulder blade kind of back and in towards midline, engaging all those muscles around the shoulder, and then you can do the same thing walking with this one. So that's just kind of a progression. If you feel quite comfortable with this, then starting to increase overhead, and same thing using all those muscles of the shoulder. This is kind of a good one if someone's in at the clinic, then the physio, whoever's working with them, can kind of be feeling and giving some tactile cues to make sure you're engaging the right muscles. Otherwise, sometimes it's a little hard to know if you're engaging kind of the right thing there. But a few different ones there, kind of starting from a little bit easier with just no weight, and then progressing to more of that overhead and weighted is kind of more a little bit end stage stuff to work on. But just because you don't have shoulder pain now, these are good ones to add in to kind of prevent shoulder pain. So if you're someone that does a lot of overhead work, or even is just going to the gym or anything like that, making sure you add in some exercises that target these muscles to prevent some of the issues that we're kind of having that come in when people aren't doing these specific exercises. So that's kind of mainly what I have there. I don't know if you have anything else, Sunny?
Well said. No, I don't really have anything else. Like you said, it's a preventative measure as well. So trying these out. The big thing with these is, like, I find a lot of people like want cool exercises and stuff, and it's not really needed. Like, it's basic.
No.
You have cueing, and that's it. Do these before your activity, and you'll notice a difference for sure.
And they actually are tough. I find lots of times, like, guys, if they're going to the gym lots, or anyone comes in and they're used to doing kind of heavy overhead lifts, and then you show them some of these exercises, they think they're going to be easy, but then once you kind of break it down and make sure they're doing it correctly, they're actually quite surprised that it's not very easy, and they're kind of more keen to do them because they're like, oh, that actually is really tough if you're doing it correctly.
Yeah, some of the lifters I treat again are like, oh, it's going to be easy. Like, no, I got to carry a kettlebell for a minute. I'm like, oh, no problem. And then by 20, 30 seconds,
It's tough.
It's very tough. So
Mm-hmm.
I like cueing, and then rather than giving like 10 exercises to somebody, just do like these 3 or 4 and then
Yeah.
continue. So if you're the type of person that notice some issues in the shoulder, pain's not too bad, try these out. And then if you're a mobility person, so your range of motion is not full, you're restricted, then go back to the YouTube page and go on the rotator cuff injury talk that Judy Chapea has led. There's a lot of good stretching in there that she did, like pec minor, she did posterior capsule stretch, quite a few different things, and then move on to more stability
Yeah.
type of exercise. So I think it's good to have both of those videos now, that way you can kind of focus on progression.
Mm-hmm.
Yeah, because you want to be pain-free and mobile first-ish,
Yeah.
and then start focusing on strength. So if someone's reducing mobility, I'll still give them some strengthening, but the shift goes on to strength when there's relatively full pain-free mobility.
Yeah.
And that's like, these are the things I follow, and I find better results than when I was giving banded stuff like lifting up, and
Yeah.
which they say now is not good. Well, like abduction and stuff.
Mm-hmm.
It's more deltoids anyways, but that's for shoulder talk number 5.
Yeah.
Yeah, so any questions anyone has? Those are good, because I like the way you did it, Brooke. 4 exercises and just get them done. So
Mhm.
everyone try it, and see how you feel. Give it a week. You're gonna feel like a different type of soreness, but a good one nonetheless. So,
Yeah.
and then Andrew, for people in physio school, definitely include this stuff in all treatment programs. There's always a way to like make it more basic and more comfortable. So it doesn't have to be
Yeah.
like a kettlebell carry. You could start on the ball. You could do those external rotations, those Ys. Like there's lots of different ways to do it. And ask us questions whenever you want. We got a thumbs up. I assume that's from the only other person on there. So a couple more minutes for questions for the Instagram peeps. And then give us ideas for more, because we're like, we've covered most joints.
Yeah. A
So
couple
now, so
times
we
now.
we could do hands. I don't know. I was gonna do a hand one, but it's just a nightmare. Like
Yeah.
there's so many, like mallet finger, and like there's too much stuff.
Yeah.
So there was somebody at the front, I think. We'll give it a couple more minutes, guys. If you have any questions, fire them off. If not, I gotta drive all around the city.
A little adventure.
Oh, I don't mind. I haven't been to the south side in a while. Wish I had more time. I'd pick up samosas. Maybe.
Is there a place on the south side that makes them?
It was my favorite place. Punjab Sweets and Restaurant on Millwoods, 91st Street and like 34th Ave.
Okay.
The best samosas and sweets, for sure. Buffet, decent. I never tried it, but
The samosas are a hit.
yeah, like back home in Vancouver, lot of samosa shops, and like usually the most ghetto looking sweet shops. The sweet shops are always good samosa shops. I know it sounds weird, but if they have good sweets, the samosas will be good.
It's a partnership.
It's like we just know. So like my cousin and I, we used to go to receptions all the time, and we used to judge a whole wedding on the taste of the appies, the samosa and another dish. And if those weren't good, you'd be like, the wedding's not going to be good.
The wedding's not good.
It's going to end in divorce. No. The rest of the food won't be good. So, based on that, no questions. Just give us a direct message, guys, or shoot us an email. You can always ask questions later. And that stability and mobility thing we talked about is explained in more detail in like an algorithm. So, if you want that algorithm, just shoot me an email or a message on Instagram, and I can send you the whole study. It's a good study, so especially if you're a physio student or interested in physio, it's a good one to read. Easy to understand. So yeah. Peace out, Instagram. Bye.
Bye.
Thank you for your time.